Let's talk about Parkinson's disease. Parkinson's disease is a progressive neurological disorder caused by the degeneration of dopaminergic neurons within the substantia nigra, a subcortical area related to voluntary motor movement, and the nigrostriatal pathway, a neural tract heading to the striatum of the substantia nigra. The neurotransmitter dopamine is involved in the coordination of smooth and complex movement. Dopamine deficits result in impaired motor activity. Severely decreased levels of dopamine in individuals with Parkinson's disease cause the disorder's most characteristic symptoms: resting tremor, rigidity, bradykinesia, that is slowness, and postural instability. Individuals with Parkinson's disease may find that while at rest, their hands, arms, and legs shake. These tremors often subside as the individual engages in purposeful movement. Early signs of muscle rigidity include a decreased arm swing while the person is walking, along with achiness and fatigue. As the disorder progresses, throat and facial muscles may weaken, causing the individual eventually to choke, cough, drool, and have difficulty swallowing. Rigidity in throat and facial muscles may also limit the range of vocal and facial expressions, causing people with Parkinson's disease to speak in a soft, monotonous voice and display a vacant, mask-like facial expression. Motor activity in individuals with this disorder are considerably slowed, particularly when they move from a resting state. Other motor abnormalities typically found include stooped posture, difficulty turning around, and gait disturbances characterized by small, shuffling steps. As brain changes caused by Parkinson's disease gradually spreads, they may begin to affect mental functions. Cognitive functions are characteristically affected with difficulty in memory, impairment in planning, and making sound judgments. The prevalence of Parkinson's disease increases with age from about 0.5% between ages 65 and 69 and to 3% at 85 years or older. The disease is more common in males than in females, and an estimated 75% of individuals affected will eventually develop serious cognitive problems. All neurocognitive disorders are classified as either major, when the cognitive decline from the previous level of performance was significant, or minor, when the cognitive decline from a previous level of performance was modest. The diagnosis may also specify without behavioral disturbance or with behavioral disturbance. For example, psychotic symptoms, agitation, or apathy. Severity specifiers indicate the overall level of functioning, describing whether the cognitive problems are mild, difficulty is limited to instrumental activity of daily living, such as managing one's finances; moderate, difficulty affects basic activities of daily living, such as feeding and dressing; or severe, the person is fully dependent. As many as half of all individuals with Parkinson's disease experience comorbid depression symptoms, which can exacerbate symptoms they're already experiencing. Research suggests that depression does not always develop after Parkinson's disease, but may in some individuals precede other symptoms of the disorder. Indeed, according to the American Academy of Neurology, in the year prior to the diagnosis of Parkinson's disease, individuals taking antidepressants were almost twice as likely to develop Parkinsonian disease as were individuals who did not take the antidepressants. This is not evidence that antidepressant use causes Parkinson's disease, but rather may suggest that depression is an early symptom of the disease in some cases. There is currently no cure for Parkinson's disease. The drug L-Dopa may be administered to increase dopamine levels in the substantia nigra, thus controlling symptoms of the disease. However, L-Dopa does not alleviate symptoms indefinitely and may cause unwanted physical and psychiatric side effects. Well, let's practice with a question for Parkinson's disease. Bradykinesia, resting tremors, gait disturbances, and depression are symptoms most commonly associated with answer A, Huntington's disease, B, Parkinson's disease, C, Alzheimer's disease, or D, multiple sclerosis. Answer B is the correct answer, as the question's stem presents the core symptoms of Parkinson's disease. A is incorrect, as Huntington's disease is a progressive neurodegenerative genetic disorder, most notable in middle age, which affects muscle coordination and causes cognitive decline and dementia. Answer C is also incorrect. Alzheimer's disease is a cortical dementia usually found in older adults and characterized by cognitive disturbances such as amnesia, aphasia, apraxia, agnosia, and diminished executive functioning. Answer D is also incorrect, as multiple sclerosis evidences changes in sensation, muscle weaknesses, difficulty in movement, problems with balance and coordination, difficulty in speech, visual problems, and with fatigue. We invite you to participate in the next chapter of our series on the key term areas affected by the DSM-5. Thanks for joining us.